the host of Doc Tales, World Doc Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. In today's topic, we're going to talk about the book Modern Medicine, which has been out for a while, hasn't it, Doc? But you're kind of giving it another place on that Amazon shelf.
Yes, it's getting another place. You're right, Neil. Yes, we started this about, I'd say, 35 years ago. 1991, I think it came out. And this we have five chapters, and we talk about the five main problems of medical care. And in those days, we were worried about expense. Of course, you know, room cost has gone from it was $300 a day then. Now we're looking at $1,000 a day or more. In some places, a normal vaginal birth can cost $15,000 to $20,000, and of course, the cesarean would be higher than that. So we really wrote the book to try to uh, get consumers to contact their legislators. There are a lot of issues that come up. We have a chapter called Big Business Medicine, and in that chapter we talk about what happens to a hospital when um, a bigger place buys it. Sometimes they can buy it for even $1. They rush in and they try to save a community. We have, for example, in North Dakota, now we have CHI have come to Bismarck, and we have Sanford also, but CHI has come to many hospitals, and then they start closing things like obstetrics, just adding to the burden of the obstetric desert and the healthcare deserts in North Dakota. So, that would be a simple thing for legislatively to repair. You could either say, you're not going to buy this hospital, you're not coming into North Dakota, or you could say, if you come into North Dakota, you're going to behave yourselves. You're not going to ransack these hospitals and these little communities. You're going to um, you're going to continue providing the care that the community needs. We also talked about the nursing shortage. That's a third chapter. And, the nursing shortage, as far as I'm concerned, certainly it's a serious problem and it's not to be taken lightly, but it's a manufactured shortage. And this all started probably again about 40 years ago, and when primary care nursing started. Now, what happened with primary care nursing is before that time, you had a division of labor. For example, you had a receptionist to answer the telephone. You had nurses' aides to uh, cart food around, bring food to patients, make sure the patients had their really clean linen and their baths, and make sure that they and vitals, and nurses would come in, they'd give the patient their medications. So, you know, when I was an orderly back in 1970, and um, we had on our floor we had 50 patients, and in the evening we had shifts were in three. I was on the 3 to 11, that is the 3 p.m. to 11 p.m. shift. We had one nurse, and that's one RN and one LPN for 50 patients. Nobody complained that there were too many patients for per nurse, but we had nurses aides, we had orderlies. Of course, I was an orderly. Today you would have to have, with this limit of 4 or 5 patients per nurse, you'd have to have 10 nurses to take care of those patients instead of one. So the situation is the shortage has been created, and that's another thing we wanted to talk about. If you're looking at really fixing the nursing shortage, the easiest way to do it would be to have receptionists to answer the telephone rather than the nurses. to have orderlies and aides checking blood pressures and pulses and carting food around and making sure patients were having their bowel movements and could pass their urine. Nurses don't really need to do that, but the so we're still laboring under the false premise that there's actually a shortage when there really isn't a shortage. So those are some of the things we talked about. We also talked about lawyers, doctors, lawyers, and liability. Now, the idea that lawyers serve to keep doctors honest is pretty false. Lawyers actually don't add anything to the benefit of healthcare. They do add cost and they do scare doctors, kind of like I suppose a mouse would be afraid of a cat. There's always been that concern. Is a lawyer going to be watching me eventually? And am I going to get my care distorted in front of a jury? But for the time being, the only thing that lawyers do is make doctors worried and drive up the cost of health care remarkably. So we talked about what the average consumer can do to bring down the cost of care. And, it would be very simple to make a law that the lawyer couldn't recover any more than $1,000. You know, imagine rather than making $4 million on a case, if you couldn't make any more than $1,000 on a case, not many lawyers would be interested in that, and they also wouldn't be getting rich off of the backs of innocent patients. So, yeah, I think there are things we can do to bring down the cost of healthcare, but consumers need to be active and they need to find their legislators.
Now, modern medicine, well, it gives you a lot of tips too, doesn't it?
That's exactly what we're talking about is how to find your legislators. And again, what we've been talking about is exactly what needs to be discussed with your legislators.
All right. So pick up Modern Medicine, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right. That was special simulcast Neil Haley Show and Doc Tales, guys. Take care.